Thank you so much for joining us at this time. I see that you appear to be at work. Tell us about the front lines in the UK today.
Thank you, Millicent. It's a pleasure to be here today. So basically, we are also in the fight against COVID-19. And so far, I think the UK is experiencing honeymoon period, I would say. Things seem to be in the decline in terms of number of new cases and in terms of the death rate as well. It looks like we've gotten to the peak and we're gradually sloping downwards. And that's why the government is looking at possible measures to put in place to relax the lockdown so that economic activities and life can gradually return back to normalcy.
We hear that there's a study in the UK suggesting that black people are twice likely to die after contracting the coronavirus as white people. What do you make of that study?
Yeah, so it's not typically just black people. It's the black and minority ethnic groups. So talking about black people, Afro-Caribbeans, the Asians, and all of that. We know that the NHS is about 70 years old. About 71 countries are represented in the NHS, and the BEM communities form about 1/3 of this workforce. So you can imagine when you expose this kind of you have this large number of people working in a particular sector, the risk of them being worse hit by whatever comes around is going to be high. The disproportionate high number of BEM community members who have died from the NHS has warranted a lot of research and discussion in the both in the public and in the health sector. So far, about 64 people of BEM extraction have died, with the Philippines having about 19 of them. 4 Nigerians so far have been reported dead, and 2 of them are actually from Rivers State. So this causes for kind of concern. There's been a lot of argument and discussions about what should be or what are the predisposing factors to this. And the one that has been put across mostly is socio-economic deprivation, and also the argument between genetic code and postcode. So for postcode, we know that rich people tend to live in some specific type of postcode. Postcode in the UK determine area or mapping or location where you live. And the genetic code is something quite questionable as well. What is it in the genetic code of black and ethnic minority groups that predisposes them to being worse hit by this? And discussions are still ongoing. And we know that for now, there's nothing conclusive anyways, but measures are being put in place because of this awareness by the NHS to ensure that the BEM community members of the NHS are protected. For instance, in the places where some of the hospitals, even where I work, BEM members are advised not to ever see any patient without having full PPE. So that's one of the measures that are being put in place. The government also is trying to cushion the effect of this death on the family members. The government has put in place measures like a financial reward of £60,000 for members of family members who've lost their family members to COVID-19 from BEM community, and also granting of indefinite leave to remain to family members, to dependents of those who have also lost their lives in the fight against COVID-19.
All right, that's a lot of great package there. But quickly now, the Prime Minister said governments will proceed on the ease of lockdown with maximum caution. Do you think the UK is ready?
Personally, I think that is a good step in the right direction, because if we put some measures in place, which the government is trying to do. First of all, what I think is informing this decision is from what the national mathematician has said, Professor Ian Diamond. It's been put across that the reproduction rate for the coronavirus in the UK is now about 0.5 to 0.9%. What that means is reproduction rate basically is the rate at which the virus can infect another person. So now it is less than 1, meaning that whoever has the virus has less than 1 chance of transmitting the virus to another person. So that is quite a positive, step in the right direction. So we're looking at this, then there is no other reasonable thing to do than to start relaxing the lockdown. And the measures put in place to relax the lockdown by extra precautions is quite commendable. The government is trying to develop an app which should be operational from mid-May, which is the month we are in now, to track and test people who are suspected to have COVID-19. So if we embark on massive testing, tracking, and tracing for people who've got symptoms of coronavirus so that we get them on time and they self-isolate, then the essence of the lockdown will have been properly achieved.
All right, Dr. Yala Douglas Pepper, GP Registrar, Queen Elizabeth Hospital, England. We appreciate your time. Thank you for talking to us. Continue to stay safe.
Thank you very much.